Can tonsillectomy really cure sleep apnea? Imagine waking up feeling refreshed after a full night's sleep. For some people, that can happen if their sleep apnea is caused by enlarged tonsils. But can removing the tonsils truly fix sleep apnea? Let's find out. Tonsillectomy, which is the surgical removal of the tonsils, can be a very effective treatment for obstructive sleep apnea when large tonsils block the airway during sleep. Obstructive sleep apnea happens when the airway becomes partially or fully blocked, causing breathing pauses and disturbed sleep. Enlarged tonsils are a common cause, especially in children and some adults. When the tonsils are big enough to block the airway, removing them can significantly reduce or even eliminate sleep apnea episodes. Studies show that many patients see a big drop in their apnea-hypopnea index, which measures how often breathing stops or slows during sleep. In some cases, this index drops so much that doctors consider the sleep apnea cured. That means breathing becomes normal, and symptoms like loud snoring and daytime tiredness improve. But the success of a tonsillectomy depends on why the sleep apnea is happening. If enlarged tonsils are the main cause, the surgery has a high chance of curing the condition. For adults with mild to moderate sleep apnea caused by large tonsils, up to 95% of patients see major improvement or complete resolution after surgery. For children, removing both tonsils and adenoids is often the first choice and works very well, especially when the tonsils are the main problem. However, if other issues like obesity, a narrow jaw, or extra soft tissue are also involved, removing the tonsils alone might not fully cure sleep apnea. In these cases, symptoms often improve but may not disappear completely. Even if the sleep apnea is not fully cured, many people notice better sleep quality, less snoring, and less daytime sleepiness after surgery. It is also worth noting that some patients might still need ongoing treatment like continuous positive airway pressure therapy, which involves wearing a mask during sleep to keep the airway open. Surgery can sometimes lower the pressure needed for this therapy. Not everyone with sleep apnea will benefit from a tonsillectomy. The best candidates are those whose sleep issues are clearly linked to enlarged tonsils. After surgery, doctors often recommend follow-up sleep studies to see if the apnea has improved or gone away completely. In summary, tonsillectomy can cure sleep apnea caused by enlarged tonsils. For others, it can still bring significant relief and improve sleep health. The decision to have surgery should be based on a careful evaluation of the airway and the underlying causes of sleep apnea.